Welcome back, dear fans. At the moment now, I have not to take much of my time. I just have to be very sincere and so clear so that it should pick me very well. I want to talk about some few things only, exactly about hypertension. If we are to control ourselves within these areas that I'm going to talk about, just only theory is enough for you to remain without high blood pressure. High blood pressure is when your blood pressure count is more than or ahead of the normal. For a normal adult, always supposed to be within the range of 80 over approximately 120 millimeter mercury. That is the standard unit and the standard measures for high pressure. So ideally, for me, theory, if you have to do this theory, at least you will be free out of high blood pressure. Even though it being that you are genetically being concorded to, I don't think you are going to get any problem at all. One, and exercises. Enough exercise for you is the parametric thing that always give you a free time instead to be out of high blood pressure. This exercise, it burns a lot of calories. It burns a lot of calories in you, and accumulation of calories in you, it gives you at least a lot of fat accumulation as well within the blood vessels and as well within the body mass. You contain a lot of mass whereby you may not even be in a position to handle it properly. So I have to be sincerely short and brief. I only pick just little of it. Do an exercise. An exercise cannot mean that you have to spend a whole day within your exercise period. No, never. Just get yourself in the morning hour and during the course of the evening hours, in case you're a little bit busy with office work and the rest of it. So an exercise, you concentrate in doing an exercise so that you burn excess fat. You burn excess fat which has been accumulated in you. You remain with a full blood vessel which is free of any accumulated fats around. Fat, for one, it gives you a lot of problem in one way. The blood vessels will be reduced. The accumulation of fats will be inside the blood vessels. The blood movement will be restricted because the pathway is narrow. So therefore, an exercise gives you a lean flesh meat inside yourself. You remain fat free, except some few areas like the kidney side, inside the orbital of the eyes, because you know very well the eyes need a really good cushion and must not remain without any single fats. You keep the eye with some fats, which is the brain work, and then within the inside of your cell around the kidney area needs some excess fat, because that one there, it needs at least some cushion, and that cushion, it works like a shock absorber for the abrasion or any trauma within the kidney. Therefore, that one needs at least some fats. And then within the heart of yourself, heart itself needs some fats. That fat there act like a cushion as well, similar to the kidney, similar to the eyes. So you cannot compromise saying that why the heart fears blood which is due to high blood pressure, due to fats. At the moment, again, it needs some more fats. That fats there has its own work and must have to be at a minimal size, not although bulky one. Second thing is, the first one has gone, now I'm into the second thing, which you need actually to do. The second thing is, get me clearly and clearly, sedentary life. This sedentary life, it is not only that local life. You see people talk about sedentary life and you think that is a local life. At first you have to begin to check on it right up from the feeding habit. There are other people who like more and evidently fat feeds. Anything that contain a lot of fats, contain a lot of oils, it gives you problem because you will pick up the weight. After picking up the weight, you gain yourself, you look nice, right? But later on, the blood vessel will begin to get to reduce. Why could the blood vessel get to reduce when you are heavy? A heavy person like more than my size, because I'm not all that heavy. Somebody bulky, you understand very well. If I mean this one, the accumulation of fat, it will cause at least the congestion inside the blood vessel in one way that excess fat will be deposited inside the blood vessels. From there, it will control the movement of the blood inside the vessels. Now, when the fat is there much, That fat sometimes can be loose and it travel not until inside the what? The heart. When it travel inside the heart, either being that arteries or the vessel, which is the veins, one of them will be having problem, or both of them will be having problem. So the restriction will be like, since the vessel is narrowed, you get yourself like, the pumping system of the heart will be restricted and sometimes need excess force. That force there gives you heartbeat. The heartbeat there will be high. Why could the heartbeat be high? Simply because that heartbeat, which is called pulse, it restricts the movement of the blood, which contains oxygen, to supply to your body self in a way that if it is high, it means it requires some work. If it is low, it means it requires some work. The minimal one or the maximum one must not be within a coincidence whereby problem would exist. So at least there is a provision for the pulse. A normal that must at least have some good pulse. That pulse there identifies a problem. When the pulse is high, it means your blood is being pumped so faster. Why the blood could be pumped faster? Because the nerve gaps is there inside the nerve vessels. So at least with me freely, it needs free moving system. It needs to flow just freely without any problem. The movement which is faster, it reflects inside, either one of the arteriotic areas or the valve or the vein inside close into arteries or the arteries itself getting to the heart, it will be having some problem. Therefore, if you are to do so much work, you reduce all that. That's why people talk of, I'm blood vessel free. I'm blood vessel free. I clean up my vessels because I was been hitting this, I've been doing this. Excessive exercises is not also again very good, but you do at least some extreme good exercise. That one will help you. And then if you eat well, it will help you. It burns more of your excess fat and you reduce the size of your body mass. In terms of lbs, sometimes people doesn't understand the kilogram, people divert it direct to lbs. It reduces your lbs, it reduces your kilogram. That kilogram, the body will be in a sustainable position to maintain it, whereby you don't feel like there is some distress like headache, a heartbeat, which is a severe palpitation, and the rest of it. So the important thing is learn to decide on what kind of feed you should bear in mind instead to control you. One, pick lean meat. Decide on only lean meat. Lean meat works best. It gives you potential to not accumulate any fat at all within yourself. Second is, avoid excess sugar inside your feeding. The feeds you are doing with it, reduce sugar. Just reduce sugar, I beg. Sugar can be stored in the body and will be diverted direct into fats. The excess fats inside you, it means it was an excess sugar. An excess sugar, which is glucose, and again, converted, it gives you accumulation, which is very wrong, can easily expose you into another thing. That one, diabetes, I cannot talk about it because now I'm for only blood pressure. So learn to understand me well here. Excess sugar, if accumulated, because it will be diverted, and again give you excess fats. Excess fats lead us to this problem we are in. I hope you have understood me very well there. Therefore, out of that, more of white meat, especially the pork, the pig meat and the rest of it, you should control how to do with it. You must not fix up himself. Just get yourself within the veggies. Take veggies simply and maximize exactly the intake seriously. If you know very well that you always feed on veggies, you are lucky. If you know very well that you don't always like fatty meat, fatty feeds, oily feeds, you are lucky. If you reduce exactly sweets in your feeding habit, you're lucky. If you don't always frequent feeding much within your capacity of you staying, you're lucky. Don't frequent feeding. Frequent feeding causes you accumulation of what is good inside a food value. Therefore, you gain weight, more blood pressure. So let us go out from there. The third thing is, learn me here very well. High blood pressure needs you to take drug. Low blood pressure needs you to take drug. But my dear brothers and sisters, my parents in general, I beg, get me right. Don't rush to drug. As well, there are some other anti-inflammatories. Don't talk about it even, neither. Those anti-inflammatories, be careful with them. Don't make any medical personnel, even though it being a professor, to induce you strongly into some of the anti-inflammatories. I cannot mention them because it's a different topic. So learn how to control yourself out of anti-inflammatories. Especially those who are having high blood pressure at the moment, just reduce anti-inflammatory use. Simply because it will really provoke you, it will culminate you wrongly. Anti-inflammatories is not all that very safe for someone who is having high blood pressure. Second thing is, when the reading is talking about something, especially the blood pressure is a little bit high but not very high, that is primary hypertension. Don't take primary hypertension like you're having serious high blood pressure whereby it needs you to take drugs. These readings here you can see, it talks about something. I can see, you might not be in a position to see it very well and properly, but instead I can point for you. See the thing? At this point, this is my 120 reading looks like from. It is exactly opposite, or it is where I'm pointing. Exactly, this is it. So the best blood pressure reading, depending on the age, but majority always lies within this. When the age is getting up, probably you will get up and above 120 in your reading. Possibly it can either be like 85 over 124, 126, 130, depending on the age. But when you are still yet young, like a youthful one, at a youthful age, or else you are above a youthful age, but you haven't taken any weight high. If you could see like the blood pressure as read from what they were taking, like their measurement, to show like either you are like 85 over 130, somewhere here, or 140. This reading here, it indicates primary hypertension. That is primary hypertension, I would say. You are not yourself to take drugs. Get me right, my dear. Therefore, it needs a lot of excess work. Don't rush yet to take medicine. If you rush into medicine, possibly you are provoking yourself, you are causing yourself a call for high blood pressure, simply because the brain will begin to use the system, saying that at the moment, I have now to begin to rely on this drug. You need now an external support. This external support, you are going to use this simple drug. Sometimes it can even be in the Philippines and the rest of it. Some people rush really, what are you taking? For me, I need the Philippines. This is how the Philippines look like. But it should not go to all this. At that level, you still need yourself to do about enough exercises, you change the lifestyle and the rest of it. So you control yourself and minus drug. Don't rush to drug. I repeat this, don't rush to drug. Drug will raise you pressure high. Even though it had wanted to go slowly, it will speed up the rate of you assessment for high blood pressure, which is a very bad news for you and the family. So control yourself and minus drug yet. So avoid toxic consumption of drugs, especially anti-inflammatory, and then the second thing, antihypertensive drugs. Don't rush into antihypertensive drugs. Let them prescribe for you and avoid over-counter drugs for any kind of sickness, but especially for this high pressure. Stop and stop and stop it, please. If you are to do these three things, 1 is exercises, 2, sedentary life, 3, restrict the use of drugs, then I will give you a very long take that you are safe out of high blood pressure. Thank you so much. I wish you the best.